Dr. Sclafani.
Are we live? We're live with like a video.
I'm doing it right now just to double check. Oh, on the wrong app. I was on Instagram.
I think we're live. Okay, so now we're live. Hi. Welcome. Oh, you can see me.
Wow.
Hi.
Hi. There's no one on here but me.
I know, but why did this not work before? Oh, there's a delay. How weird. Do we do this now or do we just go home?
Whatever you want. Whatever you want.
Let's just do it.
Okay, come on, let's
Okay.
do it.
Should I put it back up here so that we
Yeah. Can you have your colors?
my colors? Oh, what, this thing?
Yeah.
I don't know. Let's see. We're trying to make ourselves look fancy. Oh, look at us. Oh, I'm Dr. S. I should talk to Patty and be like, we're working now. We're working. It's working. Come say hi. I'm going to text Patty. Hi, everyone. Oh, it's you. I don't know why this didn't work before. This makes me very sad. But I was very prepared. Is there anyone in here? Hi! Oh, who's joined? Oh, hi. Rao? I'm Dr. S. I'm Tiffany, aka Noodle. Okay. Today is National SPF Day, so we're going to talk about SPF. I'm texting Nurse Bug. She better come.
Oh, she's in here.
She is?
Yep.
Okay. All right. So I guess after I put our talking points away. Okay. Well, hi, I'm Dr. Sclafani. This is Live with Dr. S. I'm Dr. S.
And I'm Tiffany.
And that's good. We are going to talk about SPF because today is National SPF Day. So everybody questions. All right, I'm going to put in the comments. I want to know what I can't spell what SPF do you wear? And be honest. Question mark. Because it's super important. SPF is super duper important. So everybody, tell me in your chat, in your comments, what SPF do you wear? Let's see. Oh, hi, Addie.
Hi. We have 5 people viewing.
I know, how exciting. Okay, if you have any questions for me or
Tiffany.
Noodle, wait, should I put my glasses on to make myself look fun?
Go right ahead. I'm actually blind.
My glasses are lead. They're not real. They're real for my procedures. They're just not actual. But I feel like this makes me look smarter. What do you guys think? Yes, no? Okay. All right. Let's talk. Segments. All right. Segment 1. Let's talk about SPF. What is SPF? Actually, what does SPF mean? Noodle, do you know what SPF means?
Sunblock.
Yes, yes. Very good. Excellent. It's sunblock, but do you know what the letters stand for? SPF.
No.
They stand for sun protection factor. And that basically tells you how long you're protected from the sun before you'll burn. So like if you're wearing SPF 30, that means you'll burn 30 times slower than if you didn't have SPF on at all. Did you know that's what the numbers mean?
No, I did not know.
I see we're learning things.
We're learning. I'm going to be smarter when I get out
you
here.
are. You're going to be so much smarter. So like if you burn in like 10 minutes, then if you wear SPF 30, then you will burn in like 300 minutes. So it gives you 5 hours of protection. In theory though. Because remember, sweat and water and rubbing and all that sort of stuff is not good for your SPF.
Don't sweat, guys.
Yeah.
Summer, you better bring a lot of SPF.
Yes, you have to reapply. So people forget that. Like you put on makeup and you'll put your SPF on under your makeup or whatnot, and then they think you're just good for the rest of the day. But no, it's important to reapply. You have to reapply your SPF. Yeah. And so, and now you also have to remember that so there's UVB and there's UVA, and UVA is those are the rays that actually cause skin damage. So when you're talking about, anti-aging and keeping your skin looking young and healthy, et cetera, those are the UVA rays. So UVB burns you, but UVA causes damage. So you have to, oh, the light went out. That's fine. You can still see us. So that's why you need a broad spectrum. So it has to be UVA and UVB, just not UVA. So.
Thank you, Addie. She's encouraging more viewers to
Thank
come
you,
in.
Addie. Thank you. Okay, so there's two different types of SPF. There's chemical and mineral. Well, sunscreen. There's two different types of sunscreen, chemical and mineral. Do you know the difference?
I'm going to say one is chemical, meaning it has a lot of chemicals in it, and the mineral is all natural.
Yeah. So basically, chemicals, they have different chemicals that work. So chemical sunscreen, what it does is it absorbs UV rays. So like when you're in the sun, whatever, it absorbs the rays. Whereas mineral are barriers and they actually deflect the UV rays. So that's how they work differently. That's pretty cool, right? Yeah. So if you're wearing chemical, and there's a lot of debate over what's better for you.
Yeah, I was going to ask which one is better.
I mean, I'm of the philosophy that, mineral is a barrier, so it sits on top of your skin, whereas chemical, you are absorbing it to a certain degree. So, I mean, my philosophy is if you're not absorbing it, it's good for you, right? So we don't
because it doesn't damage the pores.
Well, yeah, not just the pores, but you are technically absorbing chemicals.
Oh, that's, yeah.
There have been lots of research about chemical versus mineral, and there are no definitive, chemical is bad for you. However, chemical is bad for the environment, and we are very environmentally friendly here at IOR. One day I will introduce you to all my plant babies who help oxygenate the office. But I'm more of a mineral. I'm pro mineral because mineral, it sits on your skin, you don't absorb it, there's no chemicals. No chemicals are good, right? None of us want extra chemicals. We're exposed to pollution and chemicals every day, so why have it in our sunscreen? I have very sensitive eyes.
Oh,
so do. Yeah. So chemical makes my eyes tear and they burn. I will put on SPF 100 to go to the pool or the beach or whatever.
You're not tanning at all.
I will, because of my Mediterranean heritage, I'm Italian. I will.
Also a different breed.
Yeah, I don't know. They forgot the melanin. Yeah, the pigment genes. They made you understand. But I'll still tan through. Yeah, but I wear 100 and it'll make my eyes burn. So I stick with strictly mineral. I prefer mineral, and it's better for our reefs and it's better for the environment. So now the problem, so you'll say okay, well, if mineral's better, why do people use chemical versus mineral? The problem is mineral tends to be thicker. It's harder to spread. Also, people have darker skin tones. If you don't have a good mineral, it can cause they say a white cast. When you put on thick sunscreen and it makes you look like a ghost, like Casper or whatever.
You can't see it with me. It blends right in.
You're already. Well, but we're both fair people. But that's why so patients who have darker skin tones, they don't like mineral because it'll cause a white cast, and of course, their beautiful skin tone, you don't want to cover it with. But nowadays, with the advancement of SPF and skincare, there are really fantastic mineral SPFs out there that don't cause a white cast. So, for example, I don't know if you all noticed, but back here is our gorgeous beauty cabinet. One of the medical grade skincare products that I love is from Skin Better Science, and they have an all mineral SPF 75, which I wear every single day. And it doesn't cause any white cast, and it's a tone smart. So you can wear it, I can wear it. Somebody who has a darker skin tone, a higher Fitzpatrick can wear it. And what it does is it evens out and it matches your skin tone. So you're getting all mineral, good for the environment, SPF 75, and no white cast. So there are options out there. Yeah,
we support that. I like that.
There are options out there, sometimes people will ask, here's a question. People will ask why, if you go into the store and SPF or sunblock for children will be way cheaper than like SPF for like adult women. Like, they'll charge us like $70 for like a fancy bottle of SPF versus like baby SPF is like, $10, $15. It's because of the way they mill it. So like, in order to not get the white cast, they have to mill it like super fine. And so that's why they will charge a higher price for adult lady SPF, because we don't want the white cast. Whereas babies, they don't care. You just cover them. You cover them in the white and you let them go. So that is the difference. So like, if you can't tell, if you don't know, the ingredients in a chemical sunscreen, you're going to see oxybenzone, avobenzone, oxytenoxate, but in a quick little, and mineral is zinc oxide and titanium dioxide. But a quick little trick is if it's thicker, and like whiter, it tends to be mineral, unless you're getting a good, like actually Skin Better has sheer and they have a Tone Smart, and I wear the Tone Smart every day. Sometimes I wear the sheer if I'm like at the beach or whatever. All right. So what level SPF do you really need? This is a question that people ask.
I barely use SPF.
Yeah, I know.
And but when I go to the beach, I do. Because if not, I look like a lobster.
Okay. But
every day. I'm getting better.
Okay. Let's play fact or fiction.
Okay.
Okay, you ready, Noodle?
Ready.
Okay. Do you have to wear SPF every single day?
Yes. Okay. Do I do it? No. But do I have to? Yes.
Yes. SPF every day. Fact or fiction? Do you have to wear SPF if it's cloudy outside?
Yes.
She knows the answer, yes. Because she knows all the answers are yes. Yeah. Whether it's cloudy or sunny or you're on.
But why? There's no sun.
Actually, that's when people burn the most.
Yes.
Were you setting me up?
Yes. I know because of the pool.
No, yeah. It's like that's when people burn the most because they don't think there's any sun. I don't need SPF, and then they get burnt. Also, it's a big one, ski slopes. People don't realize. They think, oh, it's wintertime and it's cold and it's not really.
Oh, yes.
But reflection from the snow and the glare and you'll burn. So, yeah, SPF every day. SPF rain or shine. I wear SPF. I could be in the apartment and I won't leave the apartment all day, but I'll still have SPF on because there's big windows in my apartment and there's sun and there's exposure.
Well, that one I don't know if I would have known to do.
Make it part of your routine.
Yeah.
Like it's just a habit. Like I get up, shower, wash my face, whatever, put on my skincare products, and I end it with the SPF, and that's it. It's just routine. Just make it routine, and you'll never forget to do it.
Got
it. Okay. Fact or fiction? Do darker skin tones still need SPF?
Of course.
Yes, they do. That's correct. Because even though darker skin tones have melanin, which protects you from the sun, so like that's why we tan. We tan because it's protecting us from the sun. It's still not enough. So, melanin will only give you about SPF of 13, right? Which takes us, did we ever answer the first question? What SPF number are you supposed to be wearing?
No, but I'm going to guess.
Okay, sure, guess.
You're going to tell me 100, but I'm not going to go 100.
No.
I'm going to say 70 because it feels pretty lucky to me for some reason.
I mean, the higher the better. People out there, SPF 15, no. I mean, SPF 15 is like nothing. SPF 30, okay. I would love everybody to wear SPF 50 every day, at least 50. So you don't have to wear 100. I'm maniacal. Like I just, I've been wearing SPF since I was a wee babe right out of college. So, but, and I started with SPF 15 because that's what we thought that we were supposed to wear, but then we moved to 30 and now we're higher. So 50 or higher would be good.
Okay. 70 was great.
Even for you, no. 50 or higher. Yes, 70 would be fantastic. Let's see what else. Yep, that's it. Oh yeah, so people with darker skin tone, they can still get sunburn. It's not, they don't sunburn as easily as somebody who has a fairer skin tone, but they still can get sunburn, but they still get the DNA damage from the sun and there's still the possibility of cancer. And of course, cancer, again with darker skin tones, like melanoma, which is very deadly skin cancer, is rarer, but when it happens in a darker skin tone person, it tends to be more severe. And you also have to be careful. They'll get it on their palms, or they'll get it on the soles of their feet, or they'll even get it under their fingernail. So you have to be more careful and more vigilant, and that's why get me started on gel nails and the whole LED and all that sort of stuff, which I'm not a huge fan of. I do my own nails if you can't tell. You got to be careful with those people. You stick your hands in those UV lights. First of all, you're aging the skin on your hands, because if you're not wearing SPF on your hands when you go and get that stuff done, you're causing aging to your skin. Pro tip: anything you do to your face, you do to your face, you do to your neck, you do to your back of your hands, because hands will give your age away really, really quickly. Neck and hands. So that's why when you get gel nails, they have those little people wear to like protect them.
Yeah.
But you still have to be careful in your nail bed. So yeah.
Okay. Didn't know that.
I don't like not to like a horror story, but I had a friend in medical school who had an aunt who got melanoma in her skin part. So I get sprays, sun
and the scalp is what usually burns a lot.
Yeah.
Scalp, your ears.
Yeah, and people always forget ears and scalp. Yeah. So I spray, like, if I'm not going to wear a hat, I'm going to try and wear a hat. But if I'm not going to wear a hat, I spray my part. Let's see, what else? Yeah. And SPF is also, darker skin tones, they also tend towards hyperpigmentation and melasma more so. So SPF and sunblock will help prevent that and even that out. I mean, there are things that we can do, as you get older, even if you get melasma or if you get hyperpigmentation, there are things that we can do in the office, Opus, skin resurfacing, Morpheus 8 helps with that sort of stuff. So that's all stuff that we can explore if you came to see me.
Come, Garden City.
Come on by Garden City. We have lots and lots of amazing skincare products that I can help you pick out and figure out a routine that's good for you. And then also treatments, look, nobody's saying not to enjoy the sun or enjoy the outside.
Yeah, just be cautious.
Just be cautious and be careful. And then we have things that can help you correct it if we need to. So, all right. I think we answered all those questions. Let's see. Hyperpigmentation and melasma from the sun. Yes, we can help. Again, medical grade skincare. I mean, I can do a whole talk. I'll do a whole talk another time on medical grade skincare and why medical grade skincare is the best and why over the counter and organic skincare just is not the same and doesn't cut it. You need to be using medical grade skincare, but that'll be for another discussion. And then, yes, like I said, Morpheus 8 and Opus Plasma. Opus Plasma is a resurfacer. Morpheus 8 works from the inside out because it's RF microneedling, but Opus Plasma works from the outside in, and that's a resurfacer, and that's really great for evening out pigmentation, etc., and helping with hyperpigmentation and sun damage and evening skin tone and texture and all that sort of thing. And so, let's see. I guess that's it about SPF. Noodle, do you have any questions about SPF and sunblock and good sun hygiene?
I have a question. What?
Sure.
It's a dumb question, though.
No, there are no dumb questions.
Okay, if I get a 50% like protection from a sunblock and then add 20 to it, is it actually giving a 70%?
No.
Why? Isn't it like adding the two?
You made me start. No, it's not additive. No, it's
For
just
the longest time, I thought that was how it worked. So I figured if you add it, it would 50-50. Sounds like 100 to me.
Liquid Death, sponsor me. I live on you. No, that's very cute, but no, it's the 50 just will cancel out the 20. Like, Oh, and here's another thing that I didn't talk about before. Is the SPF in your makeup enough? No. That's another. Oh, see, but you don't, but you don't do. Yes, no, it is not. It is not good enough. A lot of people say, "Oh, I have SPF." My mother, I have SPF in my foundation. Is that good? No, it's not good enough. You need to use good SPF under your makeup. If your makeup has SPF in it also, that's fine. I mean, it's not going to get in the way of the good SPF underneath, but it's not adequate. And then again, if you're going to be out all day or if you're doing activities or you're sweating or you're getting wet, you have to reapply the SPF. Huh? Especially by the pool and the beach. I'm constantly reapplying. And hats and umbrellas are always good.
I'm bad with umbrellas too. I really have to get to this situation.
What do you do when you go to the beach? You don't sit under an umbrella?
No, out in the open.
Just out in the open, like on a towel?
Unless if I'm going with my mom and my dad. No one brings an umbrella. Like if I'm going with the people, like my friends and stuff, we just bring a towel.
I gotta take my glasses off for them. How? But you just said that you only burn, that you don't tan. But so how do you sit on?
I put on I put on sunblock. I go into the water and then I put on sunblock again. Sometimes it doesn't work out in my favor. Sometimes I will turn red as a lobster. It's terrible. I know what sun poisoning is, and believe it or not, I still haven't learned my lesson.
Noodle. That makes me very sad. Thank goodness you work here now.
I'm gonna add 50.
You know what I'm gonna do? I'm gonna install, like, when you walk through the front door, like, those spray machines that like spray you, like you're just gonna spray you down with sunblock every time.
I feel like I'm gonna walk through a car wash.
That would be perfect. All right, does anybody have any questions? I don't think anybody gave us any questions. Any questions? Anything? No? No? Anybody want to know anything about SPF or skincare? Do you want to ask me anything about skincare? We have a little more time. Let's see, what else? Oh. Should we tell them about the exciting special?
Oh, what's
going on in the office this week?
Why not? Mm-hmm. What's the special, Dr. Sclafani? Oh, Dr. S. Dr. S.
We are having a flash sale. A laser light.
What's a flash sale? Oh, Tiffany, I'm gonna kill you.
You're so cute. A laser liposuction flash sale. Yeah, because it's summer. We have this amazing machine in the office. It's from Alma. It's called Beautiful, and it's a laser assisted liposuction, which makes regular liposuction can be very traumatic and invasive, and this is less invasive and less traumatic, and we're able to harvest fat cells really gently and nicely, so it's better for the patient. It's less traumatic, and then also we can take that fat and we can repurpose it. So it's a closed system, and I can re-inject the fat into different areas.
Oh, well, can you inject that into my face?
Yes, I can.
Oh,
I can inject it to your face. I can inject it into your breasts. I can inject it into your butt. I can inject it into your hands. Remember earlier we were talking about how your hands.
Oh, doesn't that like make it bumpy?
What?
If you inject it to the hands?
No. Well, I smooth it out.
Because I don't know, maybe because it's more sensitive to hands or.
No, but remember how I was saying before, like everything you do to your face, you do neck, you do to your hands, is because your hands will show your age. So like, women who are like, they'll be really good, even men, taking care of their face and their neck, but then they don't take care of their hands, and their hands show their age. So you lose volume, especially like in between like the metacarpals. So I will fill those sections in with fat. So I can take it out from one area and put it back in another area. Yep. All done in the office. No general anesthesia required. Back to work in a couple days. You can technically go back to work the next day if you wanted to. I'll write you a note.
We love notes.
Yeah. In and out one day. In the office.
Interesting.
Mm-hmm.
Gotta love it.
Mm-hmm. All right. I don't know. I guess that's it. Do we have any other questions? No.
Not from my side.
Are you
Stay
gonna-
tuned. give me 2 hours. I'll come back.
Are you gonna start wearing SPF every day?
Yes, of course. I'm gonna wear SPF because I need to and because I have to.
Here, I'm gonna put on my yellow U glasses. Are you gonna wear SPF every day?
Because Dr. Sclafani.
She says yes. Her mouth says yes, but her
We'll see
heart.
when it happens when it's 100 degrees outside. If I turn red.
Yeah, for sure. I'm gonna have to walk around with a spray bottle, like when you spray cats to
Yeah.
keep them away from things. I'm gonna spray you with SPF. Okay, I guess that's it.
Thank you.
Aw, thank you, Annie. We love you. I've never done this before ever in my life, but I'm gonna do it right now. Okay, so I guess those are all our questions. So this is live with Dr. S and Noodle.
And Noodle, hi.
And I don't see Nurse Bug anywhere. But
She's got rejected by Nurse Bug.
I know. When Nurse Bug comes to visit, I don't know. We're gonna have to put her on. All right. Well, next week, same bat time, same bat channel, same bat vibe. The camera will work next time. So every Wednesday at 6:30, we're gonna do live. So we're gonna have different topics. So if anybody wants a specific topic they want me to talk about, you
leave it in the comments.
Yeah, leave it in the comments, or you can send me messages on ayor.ibc at ayor, AYUR.ibc. I don't know if you can see up there. That's abbreviated. You can send me messages. You can ask questions. You can tell me what topics you want. What do you think we should do next week? You have any?
Let's see.
Should we do another skincare? Should we do a medical topic?
Medical. I know which topic though.
Okay. Are you gonna make it a surprise, or you want to tell me, or
I will
tell us?
We can do uterine fibroids.
Okay, I like it. So next week we're gonna talk about uterine fibroids and procedure I hear, which is the procedure I do here, which is called uterine fibroid embolization. Hysterectomy is not your only choice, ladies. We can take care of those fibroids without you having major surgery. Just so you know, I guess we never really explained like what kind of doctor I am or what kind of
She is a doctor, by the way.
For all of you who have been listening to this the whole time, I'm an interventional radiologist, so my specialty is I do all minimally invasive surgical procedures, and aesthetic procedures. So we did SPF today because it is National SPF Day, and SPF is really important, and skin health is really important, and that's, a big part of my practice. But also, I do all minimally invasive procedures. So one of the procedures I do is called a UFE, or a uterine fibroid embolization, and it is for women who suffer from fibroids or adenomyosis. Unfortunately, a lot of times they go to the GYN doctor, and the GYN doctor tells them that their only choice is hysterectomy or surgery, and that is not true. That is absolutely not true. And so there is a procedure I can do in the office. Hour, 2 hours, you're done, you're home, you're recovered in 5 to 10 days. And that's what a fibroid embolization is. So next week we will talk about what fibroids are, what are our choices, why UFE is better than hysterectomy. Yeah, and that's it.
Can't wait for this topic.
Yeah, I am. I'm excited. All right. And laser lipo flash sale. If anybody is interested, if you are in Garden City on Long Island and you want to come see me, come for a consult, for an appointment. Link is in bio. I have my link tree. You can check it out. You can check out the website that talks about it. You can check me out. Yeah, I guess that's it. All right. That was our first TikTok live.
Guess what I'm going to say?
Yoodles! Yoodles from your interventional vascular care. Okay. Bye.
Bye.